This animated video was developed and produced by the University of East London as part of an ESRC grant, looking at mass population response to critical infrastructure failure, and it aims to inform others of the potential impact critical infrastructure failures can have on people with autism.
People would realise that there is a problem when they try to use their phones and go on the internet. They would ask others for information as well as listening to the radio or watching the news. As a result, more people would be walking into A&E as they wouldn't be able to call their GP. Hospitals would be struggling as their systems would not be working. Alarms would sound at Telecoms centres and management would begin to gather information and contact first responders and the press. Gabby has autism. She notices very quickly when her telecommunications devices are not working and immediately feels anxious and starts to panic, especially as her favoured means of communicating are via text, Skype and email. She immediately feels isolated and is unable to contact her support networks, which further increases her anxiety and panic. Gabby cannot find out any information from the internet, and so her anxiety increases further. The lack of information and her inability to contact anyone increases Gabby's anxiety, and she begins to catastrophize about what could happen. Some people would begin to help each other or gather in public places like pubs or schools to exchange information. Some would start to get angry, and there may be some social disorder due to the lack of contact with the emergency services. As a result, there may be a police presence on the streets. The transport systems would be severely disrupted, and people would be turning up for their journeys but would be unable to travel. The health sector would be unable to cope at this point, especially with more patients turning up and ambulances being unable to see the status of the hospital waiting lists. Gabby's anxiety levels remain high, but she's slightly reassured when she realises it isn't just her that is affected, and that the companies are working to fix the issue. However, she becomes more anxious when she notices police on the streets. Her anxiety increases even further with the noise she can hear coming from outside from the social disorder which is occurring. She is also not reassured when she sees the police outside. This is now a major incident for the sector, and they would hold emergency multi-agency calls. The military would be supporting the emergency services, and support hubs would be set up in the community. Some people would begin to improvise communications, possibly using CB radio. The health sector would be struggling, and there would be more deaths. There may be some low-level crime, organised crime targeting businesses, and some social disorder. Gabby starts to try to use alternative means to communicate, but her anxiety levels remain high. She remains anxious at not being able to use her favoured means of communication and not being able to access her support networks. Gabby will not leave her home as she is especially anxious about the increased levels of crime. She is very isolated and feels safer remaining in her home as she fears that outside is full of danger.
This animated video was produced in collaboration with an illustrator who is on the autistic spectrum. Autism is a disorder which has a wide variation of severity. Therefore, it is impossible to anticipate how everyone with autism would react. This video is intended to be a guide using the example of someone living independently with autism. For more information about the ESRC project on mass population response to critical infrastructure failure, or our work on autism and emergencies or disasters, including strategies to help and support those with autism during such situations, please see the project website at the link shown, or please contact Professor John Preston or Casey Edmonds at the email addresses shown.